Hello. So I felt like I needed to do a part 2 to this video because I didn't answer every question that was asked in the journal prompt. So when the question was asked about the impact the situation had on me understanding the PMHNP role, I would say it was very significant because that role is not only beneficial for medicating a patient or starting different treatments for a patient, but also letting a patient know that you understand what they're going through isn't easy and they may sometimes need a little more guidance than just your regular visits. And the person that I'm with, who I'm doing my clinicals with, the nurse practitioner, just letting that patient know they can reach out to her at any time on her personal line if they feel like they ever feel a little bit confused about what's going on with the tapering off of the Effexor process, being able to reach out to her. That to me was just a very, very, very significant thing, because I felt like a lot of the doctors that we go see, they tell us what to do. They tell us what to not do, and then we have to pay for another visit just to get any more information. So the empathy that I feel that she delivers to her patients is very impeccable, and that has a lot to do with the role played with the nurse practitioner, and which is why I always have loved nurse practitioners and I always wanted to be one, because first, being a nurse to me a lot of times gives us the ability to learn about compassion and have good bedside manner. Also, when exploring my strengths and limitations that affected this provider and patient relationship, I don't feel like there were any limitations at all. Strength-wise, I feel like I did a great job myself, because when I was present, I also did provide some of the education that I did understand. Of course, I did learn a lot from the preceptor that I'm with, but I do feel like I did a great job myself, because I was able to educate her on some of the different side effects that come with being tapered off of Effexor, because a lot of that I do remember, of course, learning in different courses. With the next question, discuss how you reflect your specific learning and insight. I feel like I learned a lot, not just how to be able to talk to a patient and get a patient to be comfortable and open up to you, but like I said, the education of knowing exactly what medications do for a patient when they're on them and how they work together from different classes. There are some patients who are going to be on medication from the same class, yes, but learning that it's significant to sometimes try and start them on different class meds, and when you add something new, it's more important, because that way you can actually tell what receptors are really being affected with this patient and what receptors need to be targeted. And in the future, I really want to use all of this knowledge, everything that she's taught me so far, that I've learned from her as well as from school. I feel like I'm going to use all that I'm going to learn to make sure that I educate my patients, which is always number one. I'm going to make sure that I always make them feel comfortable, make them feel open, and feel like they can tell me what's going on in any type of way, because that's the only way I can provide them the best care. And that's about it. Thank you.